One of the most important questions that we deal with when it comes to breast augmentation is, what are we going to use? And I think that it's a difficult question to address, but the first thing we have to answer is, what do you want? Every woman knows what she wants. They have an image of what they want to look like when they're at a special event or they're doing something and they really want to look spectacular. It's not for me to tell you what's right. It's not for me to try to limit it excessively. I think that the first thing is we try sizers. We see what looks good in clothing. We see how much volume you're interested in. That can be done lots of different ways. We use a standardized type of system that works really beautifully. It's made by Mentor. They're wonderful devices and they give you a pretty good idea. Then what we do is we take a three-dimensional image of you. It's not just a simulation. Although the augmentation is a simulation, the image is you. You can actually see what you would look like, not just with a relative volume, but with specific implants. The thing we can't forget is that the only person whose opinion counts is you. So when we go through the process of trying to figure this whole thing out, we're taking into account what you've already told us in terms of the volume and the limitations that your anatomy presents. If you've got a really small chest, we can't put in a really wide implant. If you've got a really broad chest, if we put in something small, it's going to look funny. So the key is that we take your desires, the limitations that we have from your body, and we try and make it as clear and precise as possible so you can get your desired result.